It is not unusual to experience some soreness or discomfort from orthodontic movement, especially after an adjustment appointment. This usually lasts from 1 to 4 days. Over-the-counter analgesics such as Advil, Motrin, or aspirin will help to alleviate this discomfort. For children under the age of 12, use the dosage recommended for children indicated on the label. Warm saltwater rinses also are helpful in reducing the swelling of irritated gums or cheeks. 1 teaspoon of salt to 8 ounces of warm water is recommended. Also, topical anesthetics are useful in relieving the discomfort from fever blisters, cold sores, irritated cheeks, or sore gums. Use them according to the labeled instructions. They are available at your local drugstore. Periodically clenching on a specially designed piece of supple plastic called a bite wafer is also a significant benefit in relieving the tooth soreness that occurs after an orthodontic adjustment. It's essential to do your clenching exercises immediately after the adjustment appointment to intercept discomfort before it gets started. This will help you continue your normal routine and to eat your regular foods without any pain or inconvenience usually associated with having your braces tightened. While we cannot guarantee results, this has proven to be extremely effective for lots of patients.